Everyone talks about nausea on GLP-1 medications. Everyone warns you about the constipation, the fatigue, the food aversions. Nobody talks about what happens to your mind. Nobody prepared you for the silence in your head, the strange grief, the moment you look in the mirror and don't recognize the person looking back. If you're on a GLP-1 medication and you felt any of this, you are not broken, you are not ungrateful, and you are absolutely not alone. Welcome back. I'm a registered nurse, and on this channel, we talk honestly about GLP-1 medications, the good, the hard, and the things your 15-minute appointment never had time to cover. Today's topic is one of the most important videos I will ever make: the emotional and psychological side of GLP-1 treatment. Because these medications don't just change your body, they change your relationship with food, with comfort, with celebration, and sometimes with yourself. Quick but important note before we begin. This video is education, not medical or mental health advice. If anything in this video resonates with you in a serious way, please bring it to your prescriber or a mental health professional. That's not a disclaimer. That's genuinely part of the message today. Let's take this gently, one piece at a time. Let's start with the science, because understanding the why takes away so much of the fear. GLP-1 receptors aren't only in your stomach and pancreas. They're in your brain, including areas involved in appetite, reward, and motivation. When you eat something delicious, your brain releases dopamine. For many people, food has been the most reliable dopamine source in their life. Stress? Food. Celebration? Food. Loneliness? Food. GLP-1 medications quiet that reward signaling around food, and that's exactly how they help you lose weight. But here's what nobody explains. When you turn down the volume on one of your brain's biggest sources of comfort and reward, your emotional landscape changes. Some people feel calmer. Some feel flat. Some feel unexpectedly emotional. All of these are real physiological responses. Not weakness, not ingratitude, not imagination. Your brain is recalibrating, and recalibration takes time and support. If you've lived with food noise, you know exactly what I mean. The constant background chatter. What's for lunch? Should I finish those leftovers? I shouldn't have eaten that. Maybe just one more. For some people, that voice has been running for 30, 40 years. It was exhausting, but it was also familiar. Then you start a GLP-1 medication and, sometimes within days, silence. Patients describe it to me like this: "It's so quiet in my head, I don't know what to think about anymore." At first, it's freedom. But for many people, that silence becomes disorienting. Food noise was taking up so much mental space that when it disappears, there's a void. And voids get filled, sometimes with anxiety, sometimes with sadness, sometimes with a strange restlessness you can't name. If the quiet feels strange to you, that's not a bad sign. It means your brain is learning to exist without a coping mechanism it relied on for years. That's enormous. Give yourself grace while you learn what fills that space in a healthy way. Now I want to talk about something that sounds strange until you live it: food grief. Food was never just fuel. Food was your grandmother's kitchen, Sunday dinners, the dish that tastes like home. Food was how your family said, "I love you," without words. Food was also your comfort at midnight after the worst days, your celebration after the best ones, your companion when nobody else was there. And now, on this medication, that relationship has fundamentally changed. The foods that brought you joy might not even appeal to you anymore. You sit at the family table and you're full after 5 bites, watching everyone else share something you used to be part of. That is a loss, and loss deserves grief. I've had patients cry, telling me they miss enjoying food, and then immediately apologize, saying they feel ridiculous or ungrateful. Please hear me. You are not ridiculous. You are mourning a relationship that was woven into your identity, your culture, your family, and your comfort. That grief is valid, and naming it is the first step to moving through it. Here's something else nobody prepares you for. Your body can change faster than your brain can keep up. Researchers sometimes talk about a lag between physical change and mental self-image. You've lost 40, 60, 80 pounds, but when you close your eyes, your mental picture of yourself hasn't caught up. Some people still instinctively turn sideways through spaces they now fit through easily. Some still reach for the largest size on the rack. And then there are the changes people don't celebrate on social media. Loose skin, a face that looks different, comments from others, even kind ones, that make you feel watched and evaluated. Some patients tell me compliments feel uncomfortable, even threatening, because attention on their body was never safe for them before. If you look in the mirror and feel like a stranger is looking back, that is a documented, common experience during rapid body change. It doesn't mean something is wrong with you. It means your identity needs time to catch up to your body. Be as patient with your mind as you've been disciplined with your health. All of this leads to the deepest question my patients ask, usually quietly, usually like a confession. Who am I if I'm not the person who loves food? Maybe you were the friend who knew every restaurant, the one who cooked for everybody, the foodie. Maybe your weight itself became part of your identity, the funny one, the strong one, the one who didn't care. When the medication changes your appetite, it can feel like it erased a piece of who you are. But here's what I've watched happen, over and over. That identity wasn't the whole of you. It was one room in a very large house. And when food stops taking up all the space, people rediscover rooms they forgot existed. The person who loves music, who wanted to travel, who had energy for their kids, their faith, their creativity. You are not losing yourself. You are meeting yourself, maybe for the first time in a long time. That process is uncomfortable. It's also one of the most meaningful parts of this entire journey. Now I need to put my nurse hat firmly on because this part matters. Everything we've discussed so far, the adjustment, the grief, the identity questions, is a normal part of major life change. But sometimes mood changes cross a line into something that needs professional care. Please talk to your provider if you notice a persistently low or empty mood lasting more than 2 weeks, losing interest in things that have nothing to do with food, your hobbies, your people, your life, feelings of hopelessness or worthlessness, significant changes in sleep, anxiety that interferes with daily functioning. And this is important. Regulators have looked into reports of mood changes and thoughts of self-harm in some people taking GLP-1 medications. Large studies haven't confirmed that the medications cause this, but your prescriber still needs to know about any significant mood change, especially if you have a history of depression or anxiety. Never stop your medication on your own. Have that conversation with your provider. And if you are ever having thoughts of harming yourself, that is a medical emergency that deserves immediate care. In the United States, you can call or text 988, the Suicide and Crisis Lifeline, any hour of any day. Reaching out is not weakness. It is one of the strongest things a human being can do. So what actually helps? Let me give you what I share with my own patients. First, therapy. If you can access it, a therapist who understands eating behavior and body image can be transformational during this journey. You spent years building a relationship with food. It makes sense to have professional support while you rebuild it. Second, community. Support groups, whether in person or online, where people actually understand food grief and food noise, because explaining this to someone who hasn't lived it is exhausting. You need spaces where you don't have to explain. Third, journaling. When the food noise goes quiet, feelings you've been eating down for years can surface. Writing them gives them somewhere to go. Even 5 minutes a night. Today I felt, that's enough. Fourth, mindful eating. You eat less now, so make what you eat matter. Small portions of foods you truly love, eaten slowly, with full attention. This rebuilds a peaceful relationship with food instead of an anxious one. And fifth, build new rituals. If food was your comfort, your celebration, your connection, those needs didn't disappear. They need new homes. A walk after hard days, music, prayer, a phone call. Your needs are valid. They just need new answers. If this video put words to something you've been feeling, share it with someone else on this journey. Somewhere, someone is sitting in that strange silence, wondering if they're the only one. You might be the reason they realize they're not. Subscribe if you want honest, judgment-free GLP-1 education from a nurse who tells you the things the pamphlet doesn't. And please, if today's video touched something deeper, take that seriously. Reach out to your provider or a mental health professional. Asking for help is part of the treatment, not a detour from it. Before you go, I want you to hear this clearly. You are allowed to be grateful for this medication and grieve at the same time. You are allowed to celebrate your progress and feel lost in it. Healing your body and healing your relationship with yourself are two different journeys, and you're brave enough to walk both. Whoever you are, wherever you are in this, I see you. Your mind deserves the same care as your body. Take care of both. I'll see you in the next one.